before we get on to Catherine in the post-neoadjuvant setting, let's talk about, I think, one of the big adjuvant things that happened at ASCO this year, and that's TRAIN-2. Anybody want to take, anyone want to take TRAIN-2? Who's the TRAIN-2 person today? Virginia, what do you think of TRAIN-2? What do you think?
I don't remember the last time I ever used an anthracycline for HER2 positive disease. I think this is kind of our way of using it in the metastatic setting when we have to, after we've given all the other agents. I think when you look at all the data, and you can talk about BCIRG 006 and how it was not powered to look at the two arms, and the AC arm was numerically superior and all of that. But when you look at the neoadjuvant pertuzumab studies, it's pretty clear that the DCHP arm has very good benefit. And so that's why I've been doing that for a long time now.
So is someone familiar with the design, just so we can tell our viewers kind of what it looked like? Someone want to talk about that? Carey, can you do that, Adam?
Yeah, so TRAIN-2 was a randomized study that enrolled patients with HER2 positive breast cancer stage 2 and 3. One group got 3 cycles of FEC, followed by 6 cycles of TCHP. The other group got 9 cycles of TCHP, and then they completed HER2-directed therapy for the full year. So about 2/3 of the patients were node positive, and path CR was no different between the two groups, about 67 and 68%. And there was no difference in the invasive disease-free survival or overall survival with the addition or subtraction of the anthracycline. They did report that febrile neutropenia was 10% in the anthracycline arm and 1% in the non-anthracycline arm. So pretty compelling data, both with path CR as well as longer term outcomes. I think the one question that comes to my mind is, would anybody start giving 9 cycles of TCHP? I know in my own practice, by the time we get to the 6th cycle of TCHP, most of my patients are pretty ready to move away from the chemotherapy portion. So I'm just curious what folks, I think it answers a fantastic question in terms of the anthracycline benefit, but it was a little different than how I traditionally give TCHP in my practice.
So
in this trial, listen, in this trial, it's very important to point out that the key was paclitaxel, not docetaxel in TRAIN.
Good point. Yeah, good point.
That's why we get so many cycles. You're right. Nobody can tolerate 9 cycles of TCHP with docetaxel.
But they were doing 9 cycles of the weekly weekly paclitaxel of THP. Is that correct? If I remember.
No, I think it was every 3 weeks.
That was every 3. So
paclitaxel, carbo, HP.
I'd have to look back. Yeah.
Yeah. I mean, I think that, again, we've been, a lot of us on this call, I mean, let me talk to Reshmi, MD Anderson, you're like the dream area of anthracyclines. How are you handling this?
So, well, since pertuzumab was approved back in 2012, I think use of anthracyclines in the neoadjuvant setting for HER2 positive breast cancer specifically has probably declined a bit. Mm-hmm. The time that I use anthracyclines tends to be in the case of tumor heterogeneity. So if we have a focus that was, for example, triple negative plus a focus that was HER2 positive that we know about, then sometimes in that type of a patient, I might opt to use the AC followed by THP regimen. But most predominantly, I have been using TCHP, and I think the TRAIN data certainly supports continued use of dual HER2 targeting as opposed to use of anthracyclines.
Adam, I stand corrected. It was weekly paclitaxel at 80 per meter squared in TRAIN.
For how long? For what? For 9 months or 9 cycles?
9 doses of the paclitaxel. The carbo was given 6 mg, 6. AUC of 6 every 3. Every 3 weeks, yeah.
That's reasonable. All right, so again, I guess the issues first, so I think we're all kind of settling on the fact that I think a reasonable thing would be, if you think there's a lot of tumor heterogeneity, do the AC followed by THP. That's probably the last place I would go with it. But short of that, I think anthracyclines in this disease may be forever on the way out. I mean, remember the Topo 2 amplification like 10 years ago, Mark? We used to go around, so that's anthracycline, your Topo 2 amplified, How far we've come is the question. How far we've come.